Please may take up a seat. Good morning, madam. Before we start, I need to confirm a few details. May I know your full name, please?
Putri Aman Safia.
Putri Aman. Thank you, madam. May I also confirm your IC number?
030170.
Great. Next, can I ask about your LMP?
I'm already period 2 weeks ago.
Alright, so there is no possibility of pregnancy, right?
Yes.
Good. Now, do you have any allergies to medication or food?
No.
Okay. Are you currently taking any medication?
No.
Noted. Okay. Before coming here, were you able to follow the preparation instruction?
Yes, I'm already taking the laxative
Okay.
and I'm already taking the clear fluid and I'm already fasting since midnight.
Okay, perfect. That means your preparation is complete. This will help us get a clear view of your colon. Do you have any question or concern before we begin the examination?
I think no.
Alright, madam, please follow me to the examination room.
Yes.
Here, madam.
Upon receiving the X-ray examination form, please ensure again the patient's name and patient's ID are correctly written on the X-ray form. Before we proceed to the X-ray examination, radiographer once again must ensure the patient is well bowel prepared by asking the patient few questions such as type of diet taken a day before, type of laxative taken, any medical and allergic history before, and last but not least, please ensure the patient is fasting at least 6 hours before the examination. Then ask the patient to change their clothes to hospital attire with all the jewelries or any metallic object that obscure the abdominal regions to be removed. Meanwhile, radiographer can prepare the examination room. Set the exposure factor to be used for the patient according to the patient size, and the size of cassette used is 14 x 17 inch.
These are the equipments. So we've got 3 types of enema tube here. We've got a non-balloon, a pediatric Felis non-balloon, or we have a balloon. Now, you need to check with your radiologist or senior radiographer with which one you're going to insert. When it comes to insertion, it is a dual procedure, so either radiographer or a nurse can insert the rectal tube. Now, let me show you this. This is called the balloon inflator. This will go on our third one right here, which is, you can see the plastic around there. So what will happen when we inflate this balloon? So when you're doing your investigation and this all hook up to your tubing, you place that into the rectum and then you inflate like that. Then you clamp across and see how big it is, and that's why your tube will not fall out. So it's very important that you also do not throw this away because they are reusable. Never insert this in dry, it needs to be moist. So we'll load up in the loop and get a little loop, put a fair bit on and glide in nicely.
A small soft tube is gently inserted into the rectum, and a liquid called barium sulfate is slowly introduced through the tube. This barium coats the lining of the colon, making it show up clearly on X-ray images. Sometimes a small amount of air is also added. This is called a double contrast barium enema, and it helps highlight even tiny details or abnormalities like polyps or tumors. During the test, the technologists will ask the patient to turn side to side while multiple X-ray images are taken. The whole process usually takes about 30 to 45 minutes, and afterward, the barium is drained and the patient can go to the restroom. A radiologist then studies the images to help doctors diagnose conditions like ulcers, diverticulosis, or colon cancer. Ask the patient to lie down with the right side on the table with hands elevated slightly to the above head to prevent superimposition with the abdominal region. Bend the patient's knees to provide more comfort. Place the cassette and grid at the posterior patient with upper border of the cassette is below the diaphragm and inferior border of the cassette at the symphysis pubis. Align the MSP perpendicular to the cassette and center the central ray at the level of iliac crest with 100 cm distance between X-ray tube and cassette. Place the anatomical marker at the proper site with no superimposition within the region of interest. Then, make the exposure during exhalation. After that, ask the patient to change the position into left lateral decubitus with left side on the table. Please make sure the patient change their position carefully to prevent the Foley catheter coming out from the anus so that it's still intact.